What does an absent seizure look like? Imagine suddenly zoning out for just a few seconds without warning. That's often what an absent seizure looks like. The person might stop talking or moving and stare blankly into space. They seem to be daydreaming or switching off for a moment. During this brief lapse, they are unresponsive to what's happening around them. You might notice subtle signs like fluttering eyelids, tiny jerking movements, or lip smacking. Sometimes, they rub their fingers together or fumble with their hands. These movements are usually very gentle and brief. The person does not fall down or lose muscle control during a typical absent seizure. After the episode ends, they quickly go back to what they were doing, often without confusion or memory of the event. There are two main types of absent seizures. The first is called typical absent seizures. These last less than 10 to 15 seconds and start and stop suddenly. They can happen many times a day, sometimes in clusters. They mostly affect children and young adults. During these seizures, the person's eyes may flutter, and they might have small repetitive movements like blinking or lip movements. The second type is atypical absent seizures. These last longer, up to 30 seconds, and tend to start and end more gradually. They may involve more noticeable limpness or clumsiness. During atypical absences, the person might still be able to move slightly or respond a little, but their awareness is still disrupted. These seizures are more common in people with other brain conditions or learning disabilities and can happen at any age. In the context of brain health and brain cancer, recognizing absent seizures is important because they can sometimes be a sign of underlying brain issues. They reflected abnormal electrical activity in the brain, which might be caused by tumors or other lesions affecting normal brain circuits. While absent seizures themselves do not involve convulsions, they indicate that the brain's electrical signals are temporarily disrupted. Early detection and medical evaluation are crucial. If someone experiences these brief lapses in awareness, especially if they happen repeatedly, it's essential to consult a healthcare professional. Proper diagnosis can help determine if there is an underlying condition like a brain tumor that needs treatment. In summary, an absent seizure looks like a quick, sudden pause in awareness with staring and subtle repetitive movements. It lasts only a few seconds, and then the person resumes normal activity. Most common in children, but it can also occur in adults, especially when linked to brain health issues. Recognizing these signs and seeking medical advice can lead to better management and help address any underlying causes. Always remember, individual experiences vary, and only a healthcare professional can provide an accurate diagnosis and appropriate care.